day to everyone. For this lecture on 150, we will talk about now yung mga diseases of goats. So, um, I will not cover all of the diseases kasi marami dyan, but yung mga i-discuss ko is more on the mga common. Yung mga common na diseases at saka yung mga may effect talaga. Merong um, yung mga crucial na diseases, yung mga important diseases ng goats dito sa Pilipinas. So, yung mga diseases kasi pag there's a prevalent ng diseases sa mga goats, usually hindi ito ganun kalala, hindi ganun na affected yung ruminant industry. Especially yung mga small ruminant industry, um, you compare it to yung mga diseases na prevalent doon sa mga monogastric, yung mga swine natin at saka yung poultry natin, talagang um, may effect yun doon sa economy, doon sa industry. Dito sa goats, medyo hindi ganun. So, um, although importante pa rin yung itong mga ma-prevent natin at saka uh, cure natin, ma-treat natin itong mga diseases of goats. All I'm saying is that when compared to the other industry, hindi ganun kalala yung mga diseases that are prevalent dito sa mga small ruminants natin. So, first is yung brucellosis. So, this is lifted from the Philippine recommends in Philippine recommends in goat production. So, ito yung mga common diseases daw na nakikita sa mga goats. So, first is yung brucellosis. So, yung brucellosis, it is caused by a bacteria. So, bacterial disease ito. So, yun yung Brucellia abortus, Brucellia melitensis, and yung Leptospira species. So, yun yung mga causative agent nitong brucellosis. So, kung yung mode of transmission or yung paano nahahawa, paano kumakalat itong disease na to is through yung mga mainly doon sa mga infected bugs natin. So they can transfer this brucellosis, this bacterial disease uh, through natural or artificial breeding. So paano nga ba? So pag yung bak mo may brucellosis, pag nag-mate siya uh, through natural mating, then naipapasa niya. So, since may close contact with each other, may papasa niya ngayon ito doon sa doe. So, meron ng brucellosis yung doe pag ganun. Or, pag naman artificial breeding, yung semen nung buck can become a vector, pwede uh, doon maipapasa yung brucellosis. So, hindi kahit may brucellosis, baka sabihin nyo, um, since close contact, pwedeng close contact kasi yung mode of transmission, during natural mating lang na may transmission. Pero pwede rin sa artificial breeding. Lalong-lalo na if the equipments, yung semen, yung mga AI gun are contaminated with the bacteria. Talagang may papasa ito doon sa doe. So, yung symptoms ng brucellosis for the doe, yung mga babaeng kambing, abortion yung una. So, abortion ng pregnant animal and then retained placenta. So, retained placenta, delikado ito if hindi talaga nailabas. So, pwedeng ikamatay nung babaeng kambing. Then, infertility and then persistent vaginal discharge. So, yun yung mga symptoms niya for the doe. And then, yung mga sterility both sa back and doe. So, as you can see, pansin nyo, yung ina-affect na part talaga nitong brucellosis is um, yung reproductive performance ng mga kambing natin. Like abortion, retained placenta, infertility, vaginal discharge. All of it ay parang related doon sa reproduction ng animal. Then, for the bucks naman, yung mga lalaking breeders natin, have swollen and painful testicles. So, yun yung parang common na nakikita natin if the animal, lalong-lalo na yung mga bucks natin, yun yung common symptoms ng brucellosis. They have swollen and painful testicle. So, pag hinawakan mo yun, mag-flinch or magre-react yung back kasi nga masakit and then swollen pa. Then, for the treatment and prevention control, for the prevention part, blood testing of bucks before introducing them into the herd. So, yun yung prevention mo para hindi walang transmission ng brucellosis doon sa herd mo. Lalong-lalo na if yung ginagawa mo is yung agbulbulod ka lang iti breeder na lalaking kambing. Kung hinihiram mo lang, you're just borrowing yung breeder back mo from other farm, then it is best to prevent yung brucellosis by testing the blood. Kasi makikita doon if it is infected by brucellosis. Then, yung mga seropositive breeder backs, gano'n rin, ikakal mo yung mga alam mo nang may brucellosis. And then, you could try vaccination. So, yon. Ito yung sinasabi ko kanina na swollen and painful testicle. So, makikita naman, it is evidently larger than yung mga normal na testicle. So, this is painful. So, swollen pa siya. So, ganyan yung symptom ng brucellosis sa mga bucks natin. Same with the sheep, ganito rin. So, yan yung brucellosis. Then, we also have what we call as the CAE or yung Caprine arthritis encephalitis. So, yung CAE, it is caused by a virus. So, virus naman ito. So, yung CAE, it is still considered an exotic disease in the Philippines. Exotic pa rin siya, pero na-include dito kasi meron siyang risk in introduce sa pag-introduce dito sa country. Kasi nga exotic. So, most likely pag exotic kasi yung CAE, hindi pa nakakapag or exotic yung disease, hindi pa nakakapag parang produce ng mga antibodies, hindi pa sanay yung goats natin doon sa disease na yun, doon sa virus na yun. So, parang mas malala yung magiging effect nun doon sa mga health ng mga goats natin. Kasi nga hindi sila sanay, exotic itong CAE sa Pilipinas. So, meron risk na may introduce itong disease na to into the country. So, considering na nag-i-import tayo ng goats from continent countries where the disease has been reported. Doon sa North America, Europe, Australia, and New Zealand. So, doon meron mga caprine arthritis encephalitis. At doon rin tayo nag-i-import. So, may risk talaga na mai-infect rin ng CAE itong mga herd natin dito sa Pilipinas. So, yung mode of transmission niya naman is CAE infection can be spread from dam to offspring through virus-laden colostrum and milk, but there is also an evidence of horizontal transmission between adults. So, mainly, yung mode of transmission ng CAE, yung dam natin, yung nagpapasuso na kambing natin, pwede niyang ma-infect ngayon yung mga offspring niya doon sa milk na binibigay niya. Kasi yung milk pwedeng nandun yung virus. So, pag nagsuso, nagsuck, yung mga offspring natin, yung mga kid natin, then, makukuha nila yung virus. So, yun. And then, there is also an evidence daw na hindi lang ganun yung mode of transmission. Hindi lang from nanay to the anak. Pwede rin from yung nanay to other nanay, from the dam to other dams, from dam to other bucks. So, yun, between adults. So, yun yung mode of transmission ng CAE. So, CAE, as the name implies, arthritis, yun yung symptoms niya, arthritis that is shown by adult goats that are infected by this virus. So, yung clinical signs include joint, capsule distentation, and varying degrees of lameness. Then, hindi makatayo, parang ganun. Over time, yung disease na yon, it progresses to para paraparesis and tetraparesis and paralysis. Then, meron na rin makikita kang depression, head tilt, then other circling, opistotonus, kung kunana, and um, paddling are observed in infected goats. Then, there is also a firm swollen mammary gland and agalaxia characterize the hard udder, yung agalaxia na yun, when the doe or yung dam natin is infected by yung CAE virus. So, lalong-lalo na at the time of parturition daw, sa panganganak, pag may agalaxia ka, then merong percentage or meron chance na may CAE virus. So, for the treatment and prevention, there are no specific treatments, but supportive treatments may benefit affected goats. So, wala talaga yung treatment na nakakapag um, um, nakakapag pa-treat doon sa virus na to, dito sa CAE na to, tong disease na to. So, yung supportive treatment lang, ito yung mga treatments na binibigay mo doon sa mga symptoms nitong disease. Yun lang. So, wala na yung talagang specific treatment na uh, can directly affect yung CAE natin. So, yun. So, yung mga aspirin natin can be given with the arthritic form of the disease. So, pag merong, yun, nakita kang arthritis, observe mo na may arthritis yung goat, then you can give yung aspirin. Then, pwede rin yung mga antimicrobial therapy, pag yung merong secondary bacterial infection na. To control naman yung spread or to control yung CAE mismo, either one of the following is recommended. So first, permanent isolation of the kids at birth. So pwede, di ba sinabi ko kanina na yung mode of transmission, pwedeng from daw, doon sa milk niya, sinasak ng kid, then may infect yung kid. So, you could isolate the kid at birth na. Then, feeding of heat-treated colostrum, pwede rin. From 56 degrees Celsius for 60 minutes. So, painitin lang yung colostrum bago mo ibigay dun sa kid. And pasteurized milk, gano'n rin. Then you need to test also the blood of the herd, and you can segregate yung mga nag-positive ng CAE. Then, pag merong mga nag-positive na, then immediate culling yung dapat gawin. So yan, meron dito sa joint niya, parang ganito, parang nagsusolen yung joint niya. So, this is yung CAE na tinatawag. Or ito, lameness or hindi makatayo, paralysis. These are some signs ng Caprine arthritis and encephalitis. Then, we also have what we call as yung Enterotoxemia. So, yung Enterotoxemia, it is caused by the Clostridium perfringens. So, for the mode of transmission niya, organism in the small intestine produces the highly potent toxin introduced via feed or water. So, yung Clostridium perfringens na ito, na pag nandoon sa small intestine, it produces yung toxin that nakukuha itong Clostridium perfringens na ito, itong bacteria na ito, doon sa feed or doon sa contaminated feed or contaminated water. So, doon yung mode of transmission. Then, yung symptoms niya, pwedeng mamatay yung goat. So, yun, biglang pagpatay ng goat. So, pwedeng caused by Enterotoxemia. So, there is a range of signs that have been reported as having been prior to death. So, hindi talaga ma-pinpoint kumbaga na if this is Enterotoxemia or ano. Basta, yung sudden death na yun, may ma-observe ka pa rin doon sa mga goats natin before they die. So, this include yung mga depression, diarrhea, bloat, staggering pain, coma, and death. And ultimately, yung death. So, since the disease is often associated with overeating, the signs other than coma and death could be associated with that. So doses of purified toxin, however, have resulted in diarrhea. So yun, aside from yung mga diarrhea, bloat, staggering, coma, mga ganun, yung overeating rin, yun yung sign ng enterotoxemia. So for the treatment, no treatment, pero yung prevention, vaccination with 2-in-1 or 5-in-1 vaccine, which include yung pulpy kidney na vaccine, which can treat yung pulpy kidney. So reduce or eliminate milk and or grains if these are being fed and provide some roughages to fill the rumen with less digestible feed. So yun yung prevention na pwede mong gawin. Pwede mong um, i-reduce or eliminate mo yung um, mga contaminated na feeds. So yun yung enterotoxemia. Then we also have yung foot and mouth disease. So yung foot and mouth disease, it is caused by a virus, yung virus A, O, and C. So yun yung mga virus that can cause yung foot and mouth disease. So for the mode of transmission, direct and indirect contact with naturally infected animals, carriers, implements, and other infected materials. Also, with the blister fluid, saliva, and other bodily discharges are highly ineffective. So, sinasabi na yung mga infected na kahit ano, infected na animals, infected na equipments, yung mga infected natin na pwedeng yung mga pinapakain natin sa kanila, lahat na pwede, basta infected nitong virus na to, then maipapasa ito from other animal. So yun yung ano ng foot and mouth disease. Then, for the symptoms, fever, vesicles, and erosion between hooves, coronary band, then you also have teeth and other oral mucosa and tongue. So meron mga parang wound, may mga sugat-sugat doon sa mga hooves nila. Then doon sa other, yung sa oral mucosa, doon sa mouth, and then doon sa tongue. Then meron ring raw ulceration following rupture of vesicles, which resulted to yung stringy or foamy salivation, smacking of the lips. So kung may nakikita kang parang ganun na sound, nag-smack doon sa na lips doon sa goat, then this may be as cause, it may be a foot and mouth disease. Then difficulty in feed ingestion kasi nga may mga ano na yan, sugat-sugat na doon sa part ng mouth. Staggering gait and lameness, then pwedeng ma-abort yung mga anak ng pregnant animal. So for the treatment and prevention, foot and mouth disease kasi highly contagious virus. So pag may nakita ka ng symptoms ng mga ganito, you need to immediately notify yung mga authorities natin, yung mga veterinarian, then dun sa DA, para ma-prevent nila, ma-control nila yung spread. Then you should designate a quarantine area and restrict the movement of the goats natin. Then you need to disinfect yung mga contaminated areas with strong virucidal solution. Yung mga caustic soda pwede. So kailangan i-disinfect talaga. Kailangan na wag mo nang i-allow yung mga animal kung pwede na pumunta sa mga pastures. Kasi pag pumunta sila sa pastures, mas higher yung chances na mahawaan yung ibang herd from other farms. Then, animals should be kept on dry ground and lesions treated with 5% formalin. So, yung mga sugat-sugat nila, you could treat it for yung 5% formalin, pwede, or any wound spray, pwede. Then you need to keep them on dry ground kasi para baka mas lumala yung sugat pag nasa wet ground sila. Then you need to mass vaccinate the animals in the herd. So yun yung prevention and treatment for the foot and mouth disease. So ito yung mukha or ito yung ng foot and mouth diseases. Meron talagang lesions, makikita kang lesions dito between the hooves, and then may mga sugat-sugat rin dito sa tongue, dito sa oral area. So yun yung foot and mouth disease. Then we also have what we call as the mastitis. So itong mastitis, um, yung causative agent nito is yung bacterial agents. So itong mga to, pwede yung Streptococcus, Pasteurella, Corynebacterium, and yung mga Escherichia na mga bacteria. So ito yung mga ano. Then also caused by Mycoplasma, Nocardia, and Candida species. So as you can see, marami yung mga bacteria that can cause nitong mastitis. So uh, yung predisposing factor na tinatawag, sores or wounds on the teeth, physical damage to the other, oral infection in kids such as ORP, unsanitary milking, pwedeng dun yung ano, parang pwedeng pumunta yung mga bacteria kaya nagkakaroon ng mastitis. So hindi talaga hindi specific sa isang bacteria ito. So kung merong mga wounds, mga sugat sa teeth, may damage doon sa other, may oral infection, doon pupunta yung mga bacteria, then pwedeng mag-cause ng mastitis. So yung ano, since ganon yung pwedeng ano ng mastitis, pwedeng direct or indirect yung mode of transmission niya. Then, for the symptoms or signs, hot, painful, and swollen udder. So, yun. Pag yung nakita ka na swollen, then pag hinawakan mo, painful, na nakikita mong painful yung udder, then that may be a cause of mastitis. It can become red due to inflammation, then can change to dark reddish blue, indicating necrosis of other tissues. So namatay na yung mga tissue doon sa udder. Then milk may be blood stained. So pag nakita mo na nagmilk ka, minilk mo yung udder nung goat na may mastitis, pwedeng merong sumama na blood. And then it may contain flakes or clots. So hindi yung parang liquid lang talaga yung lalabas. May parang clots, nagklaklamp na mga milk. So fever, pwede rin loss of appetite, depression, dehydration, gait or movement of dough is affected. So yun yung mga pwedeng ng symptoms or signs ng mastitis. So yung pwedeng prevention and treatment. So for the treatment, intramammary infusion of antibiotics. Since these are bacteria, then antibiotics yung pwede. Intramammary, dun sa mammary gland. You have yung mga penicillins, tetracyclines, novobiosins. So yun yung mga pwedeng antibiotics na pwedeng ibigay doon sa goat na may mastitis. And then, for the supportive medication, ito na yung um, treatment mo for the symptoms, yung mga swollen udder, mga ganun. So, pwedeng antihistamines and electrolytes to combat yung toxemia. Then, you also have what we call early repeated treatment, which is needed to prevent complications such as gangrene and toxemia. So, for the prevention, proper treatment of injured teeth, kasi doon pwedeng pumasok yung mga bacteria with antiseptic. So, yun. Dapat pag nakita mong may sugat yung teeth, yung suso nung kambing, then dapat i-treat mo. Properly clean it, then use antiseptics. Then, disinfecting or disinfection yung pwede mong gawin. I-disinfect mo yung udder for milking, and then monitor yung surveillance to detect early cases for immediate isolation and treatment. So, yun yung mga pwedeng prevention na gagawin mo. So, ito yung mukha ng isang mastitis. So as you can see, talagang medyo hindi ito yung normal na teeth nung kambing. You could see dito sa una, reddish na swollen. So masakit yan pag hinawakan mo. Then dito, it indicates necrosis na doon sa tissue. Doon sa tissue nung other. So parang purplish na siya. Namatay na yung mga tissue dito sa other niya. So parang kasi kaya ganyan yung mukha. Dito, nakikita rin, medyo merong necrosis na nagaganap. So, yun yung mastitis. So, pag meron kayo nito doon sa mga kambing ninyo, then dapat i-treat nyo ng antibiotic. Then disinfection dun sa area para mamatay yung mga bacteria. Then we also have what we call as ORF. So yung ORF, it is also called as contagious ecthyma or yung sore mouth. So it is caused by a virus, specifically yung pox virus. So yung mode of transmission niya is direct contact of the virus mismo. So yung symptoms, scabby lesions in the lips, muscles, eyelids, pwede rin doon sa other teeth and feet. So may mga lesions, may mga sugat-sugat doon sa mga parte ng katawan ng animal. Then warty growth development in some areas which are deep and may become necrotic or ulcerous. Pwedeng magkasugat-sugat, pwedeng lumala yung sugat, and the course of the disease is usually 1 to 4 weeks, so medyo matagal. So the scabs, yung sugat na ngayon, pag nag-heal na, will drop off and the tissue heal without scarring. The animals that have recovered from natural infection are highly resistant to reinfection. So meaning, pag yung kambing mo, um, nagkaroon ng ORF, itong contagious ecthyma na to, then wala kang ginawang treatment, wala kang ginawang anything, pag nag-recover yung kambing na yun, then it is highly unlikely na hindi na siya, mas resistant na siya doon sa infection ng ORF, doon sa reinfection. So, meaning hindi na siya, lower chances na magkakasakit siya. Then for the treatment and prevention, apply uh, yung violet or nega sound spray on the affected areas, antibiotic ointments to prevent secondary infection, and then give vitamins and minerals to boost yung resistance niya from that disease dun sa ORF. Then, vaccines are currently unavailable in the country. Pero yung virus kasi, it is also transmissible to man, and the lesions usually confined to the hands and face are more proliferative and occasionally distressing. So, ganito yung sinasabi ng mga lesions. So, may mga lesions ka dito sa muscles, sa mouth mismo, dito sa eye area, pwede rin doon sa ear. So, ito ang mga symptoms, common symptoms ng ORF. So, kung may nakita ka ng ganyan, then proper prevention and treatment yung pwede mong gawin. Then, we also have what we call as Pasteurella pneumonia. So, ito namang Pasteurella pneumonia, it is caused by Pasteurella multocida and Pasteurella hemolytica. So, yung ano niya, yung transmission niya, stress appears to be an important factor in the breakdown of respiratory tract defenses mechanisms, allowing Pasteurella species and other organisms to invade lung tissue causing pneumonia. So, ang ibig sabihin lang yan, um, nagkakaroon ng opportunity yung Pasteurella multocida, yung Pasteurella hemolytica na atakihin yung um, lung tissue kung yung animal is under stress. So yun, meaning meron ka ng pwedeng present na itong Pasteurella multocida, Pasteurella species dun sa body ng animal. Present na siya. Pero wala pa tong Pasteurella pneumonia kasi healthy yung animal. So, yun, present yung Pasteurella species pero walang Pasteurella pneumonia. Bakit? Kasi healthy yung animal. Hindi siya under stress. Pero pag naging stress na yung animal, kasi yung stress, this may cause lower, binababa niya yung resistance to diseases, yung stress. Pwedeng bumaba yung resistance mo sa diseases. So kung nagkaroon ng stress, lalong-lalo na if talagang malalang stress yung goat natin, this may cause Pasteurella pneumonia na. Then for the signs, early clinical signs such as sudden death in a few animal or a decline in feed consumption within a group can be observed. So, lalong-lalo na if 10 to 14 days after stress. Then, fever of 40 to 41 degrees Celsius. Yun yung pwede. Then, meron yung mga ocular and nasal discharge, anorexia, coughing, dyspnea, and lethargy are common. So, ito yung mga treatment pwede. Ceftiofor, then oxytetracycline, and then ampicillin and tylosin. Yun yung mga pwedeng gamot. Then, therapy should continue for at least 20 to 48 hours after body temperature has returned to normal. So, continue yung medication. And then, duration of treatment usually is 4 to 5 days bago tuluyan nang gumaling yung animal from Pasteurella pneumonia. So, ito, may mga nasal discharge. So, parang nagkakasipon yung animal. So, yan. Then, we also have what we call as tetanus. So, ito namang tetanus, it is a non-contagious disease caused by the Clostridium tetani. So, non-contagious, hindi nakakahawa mismo. So, kung may tetanus yung isang kambing, even if there is direct contact with the other goats, then hindi nakakaawa. Yung lang mode of transmission is direct infection mismo doon sa Clostridium tetani. Direct infection due to introduction of organisms uh, in wounds during castration, the horning or in ulcerating wounds. So tetanus occurs 7 to 21 days after a wound event. So meaning, yung mode of transmission niya is through yung mga sugat na pwedeng due to the castration, the horning. So yung mga sugat na yon, if it is not properly disinfected, hindi mo nilagyan ng antiseptics, doon papasok, aatake yung Clostridium tetani. So meron ng tetanus. So same with the other same with other sa human. So yung misconception kasi, if it is yung RAS, yung aglatlati na lansa or anything, um, pwedeng pagkunan ng tetanus. So, pwede rin kahit wala yung mga, yung RAS, yung mga, aglatlati. So, pwede kahit wala yun, basta yung sugat mo, it came into contact with a Clostridium tetani, then magkakaroon ka rin ng tetanus. So, yung tetanus, yung classic na symptoms niya, rigidity and stiffness of muscle. So, yun. And then, tilted gait. Tilted gait na kasi, rigid at saka stiff na yung muscle. So, hindi mo na magalaw ng maayos yung mga muscles mo. Then, this may cause abnormal gait, yung paglakad ng animal. So, stilted gait characterized yung early stages, pero yung late stages are characterized by tetanic convulsion, prolapse of the third eyelid, stiff tail. So, yung mga late stages na, ito na yung medyo malala na yung condition ng animal. May mga convulsion na nagaganap. So, pag ganun, most probably late ka na, higher na yung chances na mamatay yung kambing mo. Then, for the treatment and prevention, tetanus antitoxin. Then, it can be effective and economically justified if given during the first week of the outbreak. So, yon. Ito yung tetanus. Hindi ka na makalakad. Paralyzed ka na, mga ganun. Then, stilted gait. Then, we also have what we call as coccidiosis. So, itong coccidiosis naman, it is caused by a protozoa, yung Amyria species. So, generally, not a primary disease but exists with the other enteric diseases. So, mode of transmission, ingestion of the infected oocytes, yung mga oocytes, yung mga itlog, pwedeng yung mga itlog ng yung protozoa. So, commonly affects kids and yearlings. So, yun. Most kasi talaga ng coccidiosis, even in other animals, even in poultry, yung mga chickens natin, yung talagang ina-affect, ina-atake nitong coccidiosis is yung mga bata, yung mga kids natin, yung mga batang kambing natin. So, pag nagmamature na, lumalaki na yung kambing, more resistant na siya sa coccidiosis. So yung symptoms, diarrhea that becomes bloody and profuse, animals become dehydrated and anemic. So yung for treatment and prevention, provide good housing and clean the animal pens regularly. So dapat clean talaga para walang emergence or walang hindi magmumultiply itong protozoa na to. So dapat clean yung mga pens ng animal. Then give amprolium for 5 days or sulfaquinoxaline for 3 to 5 days. 3 to 5 days. So yun yung treatment for coccidiosis. Ito, mga diarrhea pwede. So yun yung ina-affect yung mga kids natin. Then we also have what we call as fasciolosis. Fasciolosis. So yun yung liver fluke infection natin. So yung cause nito is yung Fasciola gigantica. So ito ay isang parasite ito. So it is specifically a trematode or a leaf-like worm that inhabits the liver of infected animals. So however, mixed infection with Fasciola gigantica and Fasciola hepatica has been known to occur in some parts of the country. So pwedeng Fasciola gigantica or Fasciola hepatica, pwede dun. Magkakaroon ng liver fluke infection. So, the life cycle of the Fasciola requires an intermediate snail host, yung itong Limnia auricularia, rubiginosa, itong host na to, itong snail. So, infection is through the ingestion of contaminated grass or hay with the Metacersaria, the infective larva of the liver fluke, or through the ingestion of the floating cysts ng liver fluke that are found on the water surface. So from the time the Metacersaria are ingested, it will take minimum of 3 months for the eggs to appear in the feces of infected animals. So, yan, doon kaya hindi advisable na magpapastor ka or ilalabas mo yung kambing mo early in the morning because yung mga snails, mahilig sila na pumunta magpainit doon sa tip ng mga grasses, doon sa taas ng mga grasses para magpainit. So yun yung ginagawa. So pag nilabas mo yung kambing mo at that time, then pwede niyang ma-ingest itong snail. So itong snail na kasi na to, pwedeng nandoon yung Fasciola. So yun, kaya nai-infect yung mga kambing natin. Another one is yung floating cyst na tinatawag. Yung floating cyst naman, from the Fasciola, pwedeng ma-ingest ngayon yung ng mga kambing through yung tubig, yung infected tubig. Now, yung larva, yung cyst na yun, gagamitin na ngayon, pag na-infect na yung kambing, gagamitin nung parasite na to, yung body nung kambing para doon lumaki, doon maging adult na. So yun. Then after that, yung adult mangingitlog, then itatae ngayon nung kambing yung itlog, then mapipisa ulit, then magiging larva. So the cycle continues. So ganun. So sa liver fluke sa pagkontrol ng liver fluke, talagang yung isang recommended is pasture rotation. Para pag nagro-rotate kasi yung pasture, less likely na nakukuha mo, na-i-ingest ng mga kambing natin yung larva. So kasi niro-rotate mo. So meaning pag ni-rotate mo ngayon yung pasture infected ng liver fluke. Pag ni-rotate mo ngayon yung kambing, nilagay mo sa ibang pasture, then wala nang makaka-ingest, wala nang makakakuha nung larva doon sa pasture na infected kasi wala doon yung mga kambing natin kasi ni-rotate mo. So meaning mamamatay yung larva, then the life cycle of the larva, itong Fasciola, maka-cut off. So yun. Then yung liver fluke infection, there are two forms of the disease, yung acute and then yung chronic fasciolosis. So yung in acute fasciolosis, there is a predominance of the adult flukes over the immature forms. So merong sudden death, dullness or weakness, pale or pale na mucus siya. So yun, pale mucus yun yung parang number one na pwede mong symptoms ng isang parasitic infection. Then you also have dyspnea, ascites, and or abdominal pain. Ito yung mga common na acute cases, na symptoms ng acute cases. At necropsy, an enlarged hemorrhagic liver, kasi nga liver fluke, sa liver siya talaga. So merong enlarged hemorrhagic liver with numerous immature flukes in the liver substance could be noted with very few or no adult flukes. Kasi acute pa lang, acute symptoms. Then, for the control of fasciolosis in grazing animals needs the integration of three approaches, namely chemotherapy, snail control, and grazing management. Then the dewormers such as yung tricalbendazole, crusantel, and yung albendazole are recommended. Then 3 drenching per year are sufficient to prevent mortalities and increase animal productivity and utilization. However, there were some reports that endoparasites were showing resistance to albendazole. So, yun. I guess hindi ka na mas maganda yung triclabendazole at saka yung closantel. Kasi meron na daw resistant to albendazole yung mga fasciolosis natin. And precaution should be used to ensure the potency of the dewormer. So, ito yung chronic fasciolosis naman is the most common form seen in grazing animals. So, this form occurs when small numbers of Metaceras cercariae are ingested over a long period. Infected livers may contain few immature forms but invariably yields a significant number of adult forms. So, chronic na talaga, medyo matagal na. So, nagkakaroon na ng time na lumaki talaga yung mga fasciolosis natin doon sa liver. Signs include progressive weight loss, pale mucous membrane, and submandibular edema. Then alternating constipation and diarrhea. Then at necropsy, yung liver niya is reduced in size, the bile duct is distended, thickened, and calcified, and then there is a significant number of adult flukes could be noted. So may mga makikita ka ng mga adult na mga liver flukes. So meron rin yung mga eggs in the feces makes definitive diagnosis na. So kung may nakita ka ng mga itlog doon sa feces ng goat, then merong liver fluke infection. So ito yung sinasabi ko. Ito yung Fasciola gigantica. So dito, ito yung liver ng goat. Makikita mo yan. Ito na is chronic symptom na kasi adult na to eh. So makikita mo dyan, may mga butas-butas dyan naninirahan yung mga liver flukes. Then we also have bloat. So sa bloat naman occurs under ordinary condition of management, especially when goats are fed young and succulent herbage. Yon, more on the hindi ito bacterial, hindi ito virus. So yung bloat most probably is caused by improper management. So, pag pinakain mo yung young ng succulent herbage, yung mataas yung moisture content na grass, mga ganun. So, it may cause bloat. So, mode of transmission, non-contagious. Symptoms, swollen left flank, which is resonant when tapped. So, yun, swollen left flank. Doon sa left flank or doon sa left side nung kambing kasi, doon yung nandoon yung mga rumen. So, most probably, doon nag-bloat kasi. So, signs of colic such as uneasiness, difficult respiration, bloating, and absence of rumen movement. So, yon. And then, treatment, prevention, control. You can feed straw or fibrous diets before turning loose on lush pasture. So, pwedeng pakainin ng mga fibrous diet. In emergency cases, puncture of the rumen with large needle. Yung gauge na 15 to 16, so ganun kalaki. Or trocar and cannula. So yung trocar and cannula, equipment ito, tinutusok dun sa animal para ma-release yung gas that is causing the bloat. So yun. Then oil and fats, mineral oil, vegetable oil, or tallow are satisfactory to prevent foaming in the rumen. Kasi yung foam na yon, yung mga gas na yon, this causes yung bloat. Then commercial anti-bloat preparations such as Avinox, Timpanol, and bloat guard yung pwedeng gamitin. So ito, bloat, left side ng animal. So makikita mo na hindi naman buntis. Hindi naman buntis yung animal. Makikita mo na uneven. Kung buntis yan, even sana. Pero dito, mas makikita mo talaga na mas malaki dito sa left side. So, yan. Yan yung bloat. Dito naman, makikita mo na mayroong hunger hollow yung kambing. So, meaning, hindi siya busog. Pero, tignan mo dito sa part na to, makikita mo na bloated talaga. So, yun yung mga, ito yung sign ng isang bloated na kambing. Then, another one is yung hypocalcemia. So, yung hypocalcemia, deficiency of calcium in lactating goats. So, yung more on causes, it is caused by mineral deficiency, specifically yung calcium. So, predisposing factors, grazing lactating animals on young and rapidly growing forage, fasting or starvation in last stage of pregnancy or during lactation, this cause hypocalcemia. It is also non-contagious. Initially, yung mga doe natin shows uncoordinated gait, fine tremors seen on muscles, weakness, staggering, and finally recumbence. So those became comatose and may lie in a stretched position with head twisted into the flank. Then rapid breathing and frothing from the nose and mouth yung pwedeng mangyari. Then death occurs within a few hours to a few days. So yun yung hypocalcemia. So immediate treatment dapat give slow intravenous injection of calcium, calcium borogluconate or dextrose calcium magnesium. Then provide UMMB as supplement to the animals. Then we also have, I will just gonna talk about yung deworming. So before giving dewormers, we'd hold yung feeds for 12 to 24 hours but give large amount of water. So i-withhold mo daw, wag mong pakiinin ng feed 12 to 24 hours, pero dapat bigyan mo ng large amount of water. So this will facilitate easier drug absorption kasi, and it makes yung dewormer more effective. However, yung mga levamisole na group of dewormers, if yun yung gagamitin mo, make sure that yung animal are not empty prior to drenching. Then, if blanket deworming is to be done before or during the wet season, drench all the small ruminants in the herd. So, yung blanket dewormer, ito yung paggamit ng mga dewormer with combination products para matreat hindi lang yung iisa pero several classes of parasites. So, which is given at a high frequency. Yun yung blanket deworming. Then, make sure that the animals get the right amount of drench, double check the recommended dose on the label, and relate to the animal's weight. Then, place the dewormers near the base of the tongue. So, sa base daw ng tongue. Doon sa, ilagay mo talaga yung dewormer, yung drench mo, doon sa base ng tongue. Hindi doon sa tip ng tongue. Yeah, this is to ensure yung deposition niya in the rumen. Kasi if you drench yung medicine is delivered at the front of the mouth, usually it reaches the abomasum and becomes less effective. And then take care not to direct it to the lungs and windpipe. So yun yung pwede mong gawin, general guidelines on deworming. So with that ends my video presentation on the health management of the animals, yung health and diseases ng goats natin. So, thank you for listening.